All right, so good afternoon. Welcome to today's Lunch and Learn, sponsored by the Security Widefield Library. Today we are going to talk about Medicare-related scams. I'm going to give it about 30 more seconds to see if anybody else is trying to sign on, and then we'll go ahead and get started. Just a quick note, it was kind of a little later than I like to, but I did send emails out that included these slides for today, so that you have those for your records, for just for your FYI. And you can also use them to follow along with today's presentation. Otherwise, just a quick housekeeping tip. This is going to be a relatively short presentation, about 20 minutes. You are welcome to ask questions during the presentation, and you can do that one of two ways. You can either unmute yourself when I pause for questions during the presentation and simply ask your question live, or you're welcome to type your question into the chat box at any time, and I will address them when I do pause for questions during the presentation. Doesn't look like anybody else is signing on, so let's go ahead and get started. So again, hello, my name is Roma. I am with the Pikes Peak Area Agency on Aging through the Pikes Peak Area Council of Governments, and I am the SHIP and SMP coordinator for the Area Agency on Aging. The SHIP program is the State Health Insurance Assistance Program that provides information and education on all things Medicare. And the SMP program, the Senior Medicare Patrol program, is the program that helps people understand, identify, and report fraud, abuse, and misinformation regarding Medicare and Medicaid services. So today we're going to talk about don't get scammed. We're going to talk about some basic fraud and abuse tactics and statistics. So again, I am with the SMP. I'm the coordinator for the SMP for my region, which includes 9 counties of Colorado. The Senior Medicare Patrol, or SMPs, are a federally funded program that's designed specifically to help educate and inform people on Medicare abuse. So it helps beneficiaries prevent, detect, and report healthcare fraud. It helps preserve the integrity of the Medicare program in general, but it does rely on volunteers to perform that work because, again, this is a government-funded program, but funding is not very much. So we do strongly rely on volunteers. However, on the other hand, it is one of the more enjoyable volunteer efforts that you can do for Medicare. So what are Medicare scams? Well, the goal of Medicare scams, just like with any scam, is to steal your personal information and use that information to make money. So regarding Medicare scams, they're specifically going to look to try and steal your Medicare ID number or your Social Security number and use that information to submit fraudulent claims or billings, to get fraudulent items, using your information, items and services, that kind of stuff. There are many different ways that people can abuse Medicare and that information. Again, they can get your personal identity information and use it to bill for services, supplies, or equipment that you never received, or to bill for excessive medical supplies that you never received. They can use it to obtain free services, quote unquote free services, because taxpayers are still paying for it, or they give your Medicare number or your Social Security number to somebody else to use for those services. On the provider side, it's possible that providers could do improper coding when they're submitting bills to Medicare so that they get higher payments. They could encourage that you receive unneeded or excessive medical services such as x-rays and lab work so that someone gets paid. They can submit claims for things that are not medically necessary, that you may or may not ever receive, but weren't really medically necessary. And then typically they will use another person's Medicare number or let someone else use your Medicare number to receive services or supplies or whatnot without you knowing about it. And so again, somebody is getting paid, somebody's receiving something under your dime, under your ID, and you may not even know about it. And those are just some of the most common ways that Medicare is abused. And as with all fraud issues, there truly are consequences to Medicare fraud. It can create identity theft. So if someone gets a hold of your Social Security number or your Medicare ID number, it's not a much larger leap to go beyond that to get your date of birth, your Social Security or Medicare number, depending on which one they have at the time. Once they have that number and a date of birth, they pretty much have everything they need to get what they want. It can impact health. If someone is fraudulently using your Medicare ID number and getting services, providers are submitting claims, and then you go to use your Medicare ID number and maybe get some of those same services, Medicare could deny those services because they already paid for them, which would cause you to be upset or concerned that Medicare is denying services for you. You don't know why. Doctor said they were necessary. And in some people, it does create hesitancy to continue to get services if this kind of issue doesn't get resolved quickly. And then, of course, it can result in personal financial losses. If you're paying your tax dollars into the system and have paid into that system your entire work life, and somebody else is getting the result of you working and paying those taxes, not only is it taking that financial means, that fund, and using them up, but it may be creating bills that you end up having to pay because someone else used your benefits. Medicare fraud is huge. Billions and billions of dollars are lost every year due to improper claims being submitted to Medicare. It has honestly put the Medicare trust fund at risk. So it's not just the government stealing from Peter to pay Paul and not putting the money back, but fraud claims do account for billions of paid tax dollars to people who didn't need it or didn't deserve it or shouldn't have gotten it. In the end, it does result ultimately in higher premiums for Medicare, less money for benefits needed and services provided. And in many cases, it may impact the quality of the treatment that you receive. If doctors are not getting paid, then fewer doctors will take Medicare, and that could result in less quality doctors in the Medicare system. So it's all a kind of a vicious circle. And it really is a bigger issue than most people realize. Unfortunately, most people don't realize that it's an issue at all unless it affects them directly, which is understandable and it's human nature, but it really, as a big picture situation, is a huge deal involving lots and lots of money. So I'm going to try and play this YouTube video in the hopes that you'll be able to hear it. If for some reason you can't hear it, just let me know, and I may just email it to you. But I thought this was a really good video, a really good example of some of the fraud schemes that you may encounter any given day. So I'm going to play this real quick. Hopefully you can hear it. If not, just please let me know. Oops.
You can't hear it, Roma.
Okay. Oops. All right, so I'm getting that some people did not hear that. That's okay. I will go ahead and email it simply because I think it's worth looking at. As soon as I can. Okay. So the point of that call was, you know, someone calls you, you pick up the phone. Basically what they're saying is that they're from your doctor's office and they need to verify some information because the information they have on file doesn't seem to be going through. Can you verify your Medicare number? The biggest problem with those kind of calls is that they tend to be very generic. So when the person calls and she picks up the phone, the person says, I'm with your doctor's office. Unfortunately, they don't identify which doctor's office they're with. And they're asking for her to verify her Medicare number instead of telling her, this is the Medicare number we have on file. Can you verify that it's accurate? They are not giving her any information. They want her to provide them with information. Those are two seemingly small details that have the biggest impact on whether or not that call is legitimate. If your doctor's office truly is calling you to verify your Medicare information for billing purposes, they're going to identify which doctor's office they're with. They're going to identify specifically who they are. They're going to tell you what information they have on file first before you are asked to give them any information. Just a couple of things to keep in mind if you get these kinds of calls. I know people are getting these calls as well as other kinds of calls, which include someone saying they're from Social Security, someone saying they're from the IRS, someone saying they're from Medicare. The number and variety of types of fraudulent calls that people can get on any given day is incredible. It's absolutely incredible. The variety and the, what's the word I'm looking for? The imagination of these calls. Some of them sound very legit. And some of them look very legit. So let's talk about common methods for fraud calls or fraud of any kind. So telephone calls obviously are pretty common. It's harder and harder and harder these days to tell from your caller ID if the person who is calling you is legitimate. Telephone calls now are typically going to be subject to what's called spoofing. And basically what spoofing means is that someone committing fraud, someone who's trying to get information from you that's not legitimate, has somehow managed to create on their account, their phone account, the ability to use a caller ID so that that call is identified on your end as coming from Medicare or Social Security or the IRS or, you know, the local police station, the FBI. I mean, I've had people tell me they've gotten calls from all kinds of organizations and entities claiming one thing or another. So unfortunately, what that means is these days you can't rely on your caller ID to tell you who's calling sometimes. If you pick up the phone because it looks like Medicare is calling you or Social Security is calling you. A couple of things that you want to keep an ear out for that call. First of all, the most important thing is to be skeptical anytime you see that kind of information on your call ID, because the bottom line is Medicare does not call you. Social Security does not call you. The IRS is not going to call you. Big entities like that, big government entities like that are typically never going to call you unless you have called them first and are expecting a call back. So that is clue number one, that it's probably not going to be a legitimate call. Clue number two, again, is going to be what kind of information the caller is telling you within the first 10 seconds. Are they identifying who they're with? Are they stating clearly who they're with? And what do they want? Are they asking you to give them information, or are they giving you information that you need to verify? Those are key rules of thumb to keep in mind whenever you pick up the phone, thinking it might be an important call. But again, the likelihood of Medicare calling you or Social Security calling you is so slim, unless you are expecting them to call, that the bottom line is it's not usually going to be a legitimate call to begin with. Unfortunately, many people do fall for that. And that's why it's such a commonly used method these days. The next most common message, emails, illegitimate websites, even text messages. Most of these are going to be fall under the phishing scams category. Phishing scams are basically the type of scam where these criminals are trying to impersonate legitimate organizations in order to steal your information. Again, all of these types of scams have the same ultimate goal: to steal your information so that they can use it fraudulently. So emails are particularly plentiful these days. Lots of scam emails that you probably don't even want to open. Scammers use fake email addresses, fake website addresses. I know even I get some fraudulent text messages that have, 2 or 3 word text and then a link that they want you to click on or open. Don't do it. Online advertising you see maybe on Facebook or any of those social media platforms. Just because it's on a legitimate platform does not necessarily mean it's always going to be a legitimate link to a legitimate website. Sometimes these websites can even fool the platforms into putting their information on there. So you really have to be very careful when you are thinking about clicking on an email or a website or a text message because you think it might be important or something that you would be interested in. Again, if you're not actively looking for something or trying to contact a specific entity or website, probably don't want to click on anything that was sent to you without you wanting to have that information, without you actively seeking that information. One of the easiest ways to determine whether an email or a website is legitimate is, if you're on the computer, is to hover, use your mouse and your cursor to just hover over the email address that the email came from. Because typically scam email addresses are going to look very weird versus other email addresses, common email addresses. And even if the email address shows as it's coming from Amazon.com, if you hover your cursor over that email address, it will actually show you the actual email address versus what it says it is. And that's always a good way to double check whether or not something is legitimate. Again, all of these are pretty common schemes. They're usually attempting to verify your information due to errors. Sometimes they're trying to offer you free supplies or services. Sometimes they're offering or claiming that you're entitled to refunds from Medicare. Medicare is never going to refund you because you don't pay Medicare directly for anything except your premiums. When it comes to claims, Medicare pays the providers, not you typically. Or again, one very common one is you need to update your Medicare card or your Medicare information. Again, always be careful as to what they're asking you versus what they're telling you. Any questions about any of this so far? Again, you can either just unmute and ask your question, or you can type it into the chat box. Okay,
Roma, I have a question.
sure.
I don't know if it's relative now or later, but what about if you get, I don't know what you call them, scam? I have on my phone, I will get, they look like emails, but whatever it is, it's obviously not, it's a scam, or it's a bad, something you wouldn't want to open. How does that happen, and how do you get it off of your phone? I know how to do it on email, or have a better sense if you can get protection on your email, but how do you stop that?
So is it like a text message?
Well, it's like a one-liner with, yeah, sometimes it's text, or sometimes it's a one-liner with numbers and letters in it, and they want to entice you to open it. And of course I don't, I have to click on it to delete it. But it
Well, not necessarily. If you are on a smartphone, most smartphones give you the ability to delete something without actually opening it by, I know on iPhones specifically, because that's what I have, by swiping, just swiping from right to left, and it usually delete option.
I didn't know that. I can try that, but okay, I can try that. But how does that happen?
How do they get your number?
Yeah, how do they do that?
You know, it's almost impossible to totally shield your number or totally make your number invisible to general population. Somebody somewhere out there, unless you pay the phone company to not publish your number anywhere, and even I'm not sure it's 100% doable, there's always somehow, some way that your number and your name are available somewhere. So I know for regular phone numbers and mailing lists, I mean, I can go online and pretty much buy a mailing list that includes someone's address, name, phone number, date of birth, whatever demographics I want, for $50.
Okay.
Not that expensive to get that information. I'm not sure of the specifics when it comes to phones and electronics, emails, but I know it's not much different than just asking for a mailing list and paying for it based on whatever demographics I want.
Well,
So,
is there I'm sorry.
go ahead.
Is there a program you can, like with your emails, you can buy a security to.
Yeah, but even that,
do that from your phone?
even that's not always going to be 100%. I mean, the first thing people should do is register their phone numbers on the do not call lists, both for the state and for the feds.
Okay.
That doesn't always necessarily stop the calls or the texts, but it does significantly reduce them by being on those lists. And it does help if you do continue to get calls or texts after you've registered and put yourself on the do not calls lists. It helps with prosecution if that particular entity continues to violate that do not call list. So it does help the government when they have to go after those particular entities who are still calling and violating the do not call list. Again, I can send that information. Actually, no, I do have it at the end of the slides. I do
Okay, good.
information, I believe. If not, I will email it after the presentation. Again, that's not going to be 100% effective usually, but
Yeah,
it does significantly reduce those kinds of calls and texts.
okay,
Then
thank you.
usually for emails, you always have an opt-out somewhere or the ability
Right,
to block.
okay,
Even on your
thank you.
phone, you should have the ability to block those specific emails or texts. You can always block them,
Oh,
but that doesn't mean that entity won't turn around and just use a different one. So
right,
it could be an ongoing and constant battle that I think we all fight. But there are ways to reduce that traffic.
thank you.
So the SMP program, Senior Medicare Patrol, again, a federally funded program that is designed to help protect, detect, and report Medicare fraud and abuse by educating consumers on the types of things to look for, the types of things to put in practice so that you become less susceptible to being a victim. So some of the easiest ways to protect yourself and others from fraud and abuse, obviously, be careful with your Medicare number and who you give it to. It's recommended that you treat your Medicare card like a credit card. You don't give out that information to anybody who absolutely does not need it or that you don't know. So again, if you're getting a phone call from an anonymous doctor's office and they want you to verify your number, but they're not telling you what that number is first, then you need to be suspicious. They should always, anybody calling you to verify your Medicare number should be telling you what they have before they ask you what it is. Always be suspicious of calls from numbers you don't recognize. Even if it looks official, even if it looks important, that does not necessarily mean it is. If you pick up that phone and you're not getting a clear understanding of who you're talking to, ask who you're talking to. It's at that point that I would also encourage you to grab a pen and a piece of paper and start writing what they're telling you down. Again, be aware that Medicare does not call you, does not knock on your door to sell you stuff. Social Security does not call you. The IRS does not call you unless you have called them first and are expecting them to call you back. They do not call you. They do not have the time or energy to contact you first or without you needing something from them and expecting them to call you. And always, always be cautious of offers for free anything, especially if that free something has the caveat of they need your Medicare number in order for you to get it. And don't be afraid to pass these tips on to friends and family. The more people who know what to look for, know what to listen for, know what to do if they start getting these calls or suspecting that these calls or emails or texts are not legitimate, the better. The more people who know, the fewer people who will become victims. And the more likely someone will report these scams and these scam artists to the Federal Trade Commission so that they can go after them. And that's why I always recommend that if you can, grab a pen and paper and you start asking the caller questions. You know, if they're calling and they're not clearly identifying who they're with, but they want you to give them information, don't hesitate to say, you know, I just got out of the shower. Can I get a phone number to call you right back? They're typically going to give you a phone number. They're typically going to say, here's my direct line. Write that number down. Even having just that phone number, if you report that to the Federal Trade Commission, if you report that to the state of Colorado's Division of Insurance Fraud Department, that information is incredibly helpful for them to try and pursue those particular fraudsters and get them to stop what they're doing and pursue criminal charges. Things that you don't want to do, Obviously, don't give out your Medicare number to anybody who doesn't need it. Don't be afraid to tell a caller to call that you need to call them back and ask for that phone number. Worst case scenario, or when all else fails, don't be afraid to hang up. Some people think it's rude. Some people just, instinctually have a problem with just being rude and hanging up on somebody. Don't be afraid to hang up. The whole point of someone calling you and engaging you in a conversation is to try and get your information. And I can tell you they are very good at trying to keep you on the phone. That's their job. The longer they can keep you on the phone, the more likely you're going to give them something that they shouldn't have. Don't be afraid to hang up. Who cares if it's rude? If you don't be rude, they very well could end up getting something you didn't want them to have. And don't be afraid to report these calls. There are multiple ways you can report these calls if it's suspicious in any way, shape, or form. It doesn't have to be a true illegitimate fraud call. If you're suspicious of the call and you report it and it's not a fraudulent call, that's okay. It's better to be safe than sorry than to think it's suspicious, not report it, and something happens or they get away with something. The fewer people that report those suspicious calls means the more people that will ultimately fall victim to such calls. So the more people who report it, the more likely they will be caught or at least stopped, the fewer people that will become victims. Other good tips or advice for helping protect your Medicare benefits and Medicare identification is to keep track of your medical appointments, your providers, and the services that you are receiving. If you can make notes, jot notes down on a calendar, if you can write it all down in a notebook, what that's going to help you do is when you get those Medicare summary notices every 3 months, you'll be able to go back in your notebook and make sure that all of the services that Medicare got a bill for are services you actually received. Many times people who are using your number illegitimately to receive services know that they're going to get away with it because A, unless you go on to Medicare.gov because you've created a My Medicare account and are looking at your claims on a regular basis, they know that you're only going to get those paper statements from Medicare once every 3 months. And they can do a lot of damage in a 3-month period. But even if you're only reviewing and comparing what was billed to Medicare to what you actually received in services once every 3 months, it's still better than never looking at it at all. And if you see something that you don't have noted on your calendar or your notebook, you're sure you didn't get that service, you need to report that because somebody obviously did. Read your summary notices, your benefits of explanation. Those are going to be the paper statements that you are mailed once every 3 months from Medicare, the Medicare summary notices that outline in detail every provider that billed Medicare for any service you received in the previous 3 months. It's going to tell you who you saw, when you saw them, what specifically the service was that you received when you saw them, how much they billed to Medicare, what Medicare approved and paid, etc. Very detailed information. And again, if you see something being billed to Medicare that you did not receive, that's a problem. That's something you need to tell somebody, Medicare Division of Insurance, your local S&P office. And again, it's always a good idea, not required, but it is a good idea and it's recommended that you create a mymedicare.gov account. You create a mymedicare.gov account through the medicare.gov website. There are a lot of benefits to having a My Medicare account. And I am happy to email a handout that walks you through creating that account if you would like. But it gives you the ability to look at your claims in real time instead of having to wait every 3 months. It gives you the ability to save a meds list for Medicare Part D or drug coverage through your Advantage plan, which comes in especially handy during open enrollment. It gives you the ability to print out a temporary Medicare card. It gives you, there's just lots and lots of information that you can access through that My Medicare account at a moment's notice that you would otherwise have to wait to get in the mail or have to pick up the phone and call Medicare to get. And again, I'm happy to email a handout that walks you through how to set up that account if you would like me to. And then, of course, the most important thing to do if you suspect you're getting fraudulent emails or fraudulent phone call is to report it. If you don't report it, then it may as well have never happened. Which is why having a notebook and pen are handy so that you can jot down whatever they're telling you or whatever the email or text is telling you, and then call us. We are the local SMP office, so we can provide counseling and education regarding any of the things that we've talked about today for the 9 counties that this office serves under this program. I've provided our local phone number here in Colorado Springs, but you can also call the office, the main office at the Division of Insurance up in Denver to report it directly to the state. You can go online for this information. I've provided the Division of Insurance website for the Senior Medicare Patrol, as well as the email address to report fraud and abuse. The National Senior Medicare Patrol website, which you can also access for more information, and the link to the Federal Trade Commission's website where you can report fraud and abuse. I do apologize. I thought I'd put the no call information on here, but again, I'm happy to email that information to anybody who would like it, as far as how to get your name on the no call list for both the state of Colorado and the national call list, and any other information that I've mentioned that you would be interested in. And that's about all I've got for you today. Again, I am Roma with the Area Agency on Aging, the Medicare coordinator for Medicare counseling and the SMP program. You are welcome to email me with any questions if you think of them after this presentation is over. This presentation has been recorded and will be posted to our website within a couple of days. If you would like to schedule an appointment to talk to a counselor about a specific situation in more detail, we're happy to arrange that as well. We do have 5 full-time counselors currently and a couple of part-time volunteers. We're all fully trained in Medicare and SMP programs, and we're happy to talk to you at any time or schedule an appointment. I've also included the toll-free statewide number for the SHIP program. Calling that number will route you to the SHIP office closest to where you're calling from, anywhere in the state. Any questions before we wrap it up? All right. Well, I do appreciate you coming and watching this presentation. I hope it was helpful. If you have any suggestions or comments regarding this presentation, or again, suggestions for future presentations, please let us know. I'm happy to get an email. You should also get a survey emailed to you sometime in the next couple of days to rate this presentation, as well as a link. It'll provide a link to the recording of this presentation. Again, if you'd like me to email you any of the information that I mentioned, please shoot me an email. I'm happy to do that. Otherwise, again, thank you for joining us today. I hope it was helpful, and hopefully we'll see you next time.